Hey, I'm Dr. Kethu. I'm a board-certified gastroenterologist practicing in USA. In my practice, I see a lot of patients with different gut issues. They read on the internet about leaky gut and ask me if they have leaky gut. I thought we should dive into the mysterious world of leaky gut. What is it? Is it the same as IBS? What's the deal with all the myths and facts? Let's get into it. What exactly is leaky gut? Officially known as increased intestinal permeability, it's when your gut lining gets a bit too permeable, allowing stuff to pass through. Toxins and bacteria in the intestines are able to leak through the leaky gut and can cause inflammation wherever they may end up. Imagine your gut is like a fine mesh, and leaky gut makes that mesh to have bigger holes. Studies show that leaky gut might contribute to autoimmune conditions and certain chronic inflammatory diseases. Now, is leaky gut the same as IBS, irritable bowel syndrome? Well, not quite. While they can share some symptoms like bloating and abdominal discomfort, they are separate conditions. IBS is a functional disorder, meaning it affects how the gut works, but not its structure. Leaky gut, on the other hand, involves changes to the gut lining itself. IBS is diagnosed based on symptoms and exclusion of other conditions, while leaky gut is not officially recognized as a diagnosis by many people in the medical community. What about similarities? Both can cause a lot of digestive issues. Studies show that some people with IBS might have increased intestinal permeability, linking the two conditions in a roundabout way. Now, there are a lot of myths around leaky gut. Let's talk about those. One myth is leaky gut is just a fad diagnosis. The fact is, while not universally accepted, there is growing research on the role of gut permeability in health. Another myth is only people with the digestive issues have leaky gut. No, the fact is conditions like diabetes, arthritis, and even depression have been linked to increased gut permeability. What are the symptoms of leaky gut? Usually you will have abdominal bloating, gas, abdominal cramps, food sensitivities, and generalized digestive upset. Some people also report systemic symptoms, meaning fatigue, headaches, joint pains. It's like your gut's way of saying, help, I'm leaking. Now let's discuss what causes leaky gut. The number one reason is chronic stress. This triggers hormonal responses that directly damage intestinal tight junctions. Number two, poor dietary choices, particularly processed foods, excessive sugar, and inflammatory ingredients progressively weaken the gut membrane integrity. Number three, certain medications, especially long-term antibiotics or non-steroidal anti-inflammatory pain medication use, can break down protective gut lining. Number four is chronic infections, both viral, bacterial, can create inflammatory responses that compromise intestinal permeability. Number five, alcohol consumption acts as a direct inflammatory agent, causing significant gut membrane disruption. Number six is autoimmune conditions and genetic predispositions can further accelerate gut barrier dysfunction. And the seventh cause is environmental toxins and chronic inflammatory states that can also cause leaky gut. Remember, it's usually a combination of these factors, not just one, that can disrupt the gut barrier and leading to increased permeability. Now, how do we manage leaky gut? So it involves dietary changes, stress management, and possibly supplements. Number one is foods rich in fiber, probiotics, and prebiotics that can support gut health. Fermented foods like yogurt, sauerkraut, kimchi, Indian dosa, and then leafy greens and whole grains are the best bets. Number two is avoid sugars and ultra-processed foods. Number three, reducing stress through exercise, meditation, or even just a good laugh can also help. Number four, avoid alcohol. What about supplements? Probiotics and prebiotics support a healthy gut microbiome. Studies show that L-glutamine can help repair the gut lining. But remember, always talk to your doctor before starting any new supplement. Leaky gut might sound scary, but with the right diet, lifestyle changes, and a bit of tender loving care, TLC, you can manage and even heal it. Thanks for watching. I want to hear from you. Have you ever experienced symptoms that might be linked to leaky gut? What have you tried to improve your gut health? Share your experiences, thoughts, or questions in the comments below. Don't forget to like, share, and subscribe for more insights on taking care of your health. See you next time, and remember, your gut health is your overall health.